Well, first up on the show, and Britain has reported its highest death toll with a record 569 deaths in one single day. It also reported the second highest increase in the number of positive coronavirus cases, with a surge of 4,424 cases, taking the total number of infected cases to over 33,700. With mounting pressure on the government to contain the virus, the officials have promised to carry out more tests and ensure protection for frontline medical staff as well. The Health Secretary, Matt Hancock, promised action. Hancock, who himself was in isolation, returned from a quarantine after recovery and said that the rate of infection had been doubling every 3 days. He also said that the government had set a goal for testing 100,000 people per day till the end of the month.
The new national effort for testing will ensure that we can get tests for everyone who needs them. And I'm delighted that the pharmaceutical industry is rising to this challenge and putting unprecedented resources into testing. Taken together, I am now setting the goal of 100,000 tests per day by the end of this month.
Britain has tested 153,000 people so far, and the vast majority of those tested are patients in hospitals. There's also growing concerns about lack of protective gear and medical equipment for the medical staff treating patients. However, despite being susceptible to the deadly virus, the state-run National Health Service has been at the forefront of fighting the pandemic. Londoners came out on their balconies and applauded health workers for their work. And the British Prime Minister Boris Johnson, who is currently in self-isolation, also joined a national round of applause for doctors, nurses and essential staff as well. Now, growing cases of coronavirus are going undetected and untreated in Britain due to the lack of medical facilities. In order to fight this hurdle, the British Army has also been roped in. The Army is now setting up a temporary hospital with 500 beds for COVID-19 patients at a sports centre in northwest England.
Due to take 3 days. However, as always, we will remain flexible to support the NHS where possible. So if any of the tasks do come up, we will remain on standby to support that as best we can.
The lethal coronavirus has infected more than 33,700 people and has killed over 2,900 in Britain. As of now, close to 163 patients are under critical care and 135 have recovered completely. And well, WION's London Bureau Chief Mandy Clark is now joining us live from London for the latest on the ground situation. And well, Mandy, a 24% spike in cases in the last 24 days or hours, I beg your pardon, and it seems to be that UK is in a critical condition at this moment.
Absolutely. The peak of what they were expecting, these numbers of cases to be doubling every day. Matt Hancock yesterday stated that it is happening sooner than they expected. Of course, these are the infection rates before the lockdown. The lockdown is less than 2 weeks old. And so hopefully by the end of this week, this is where the government has said they are hoping to start seeing a leveling off. If they don't start seeing a leveling off at the end of this week, that means the lockdown hasn't been stringent enough and there may be new measures. But a lot of these cases were essentially infections before those measures have come into place. Now, the big question that the government has been facing was that should they have not locked down much sooner the minute the coronavirus was detected in the UK. And so that is where they're facing a lot of criticism. Of course, Matt Hancock himself got the coronavirus because they weren't adhering to their own rules when it comes to social distancing. So he was a far more cowed health secretary in that press conference, acknowledging that perhaps they should have moved sooner, but now the main focus is getting those essential vital PPE equipment and especially those tests, antibody tests, those blood tests to those frontline healthcare workers. So that is the state where Britain's in, and they're just really waiting to see if these lockdown measures will have an effect and flatten that curve.
Right, the lockdown measures, of course, Mandy, coming a bit late, but how does the UK government plan to get these testing kits and test more people and also get more equipment and gear for its medical staff, given that seems to be the critical problem for all countries at this point?
Yeah, and the NHS procurement system really came into really kind of got examined yesterday. The fact that they didn't really they had a select of suppliers, and it was very red tape. They needed to get rid of this as a moment of national crisis, pull in all those private sector companies that can come and help make ventilators, create those PPE equipment. So it was really putting a spotlight on the level of red tape that's still in existence and really shouldn't be. This should be all hands on deck. So that is now their new measures. They're removing a lot of the paperwork, essentially, that slowed down it. Hopefully that will make a difference so they can move supplies to the chain and get it to the front line where they need it the most.
Right, absolutely, Mandy. Thanks very much indeed for that. And this, of course, coming at a time when the UK's death toll has now surpassed that of China. Thanks for that.